Okay, this is the moment you've been waiting for, actually talking about the nervous system states. So when you look at all of these states here, what do you think each state represents? So do your little quiz here before we begin, and we'll actually talk about each in a bit more detail. So the nervous system is always responding to threatening stimulus. It's actually always on and looking for any threat. And if it does perceive a threat, it's going to respond instantaneously without us thinking. There is a reason why our survival centers are back here anatomically. That is not a coincidence. It's because if we feel the threat through our body, it is the least distance, right? Those signals are going to come up here really quickly for our survival brain to react and respond to stimuli, so we can either fight, flight immediately, right? That's why it is there. And so when we are threatened, there is actually very minimal input from our cortical processes. So a lot of our frontal lobe, which is involved with thinking, critical thinking, higher level functioning, decision making, it takes time for it to get up there, because we want to be able to run as fast as we can if in case we get mauled by a tiger, right? And it takes a bit of time to travel for these stimuli to travel there, because we don't want to overthink, right? If there is an actual threat, we want to be able to get the hell out of there instead of figure out what is going on. We just go. And so, of course, this is fight, this is flight, this is shutdown, and this is freeze. And let's talk about them. This is just another review of the different autonomic nervous system states. Sympathetic is fight or flight, and in parasympathetic, we have the two branches of ventral vagal, which is where we want to be for the most part. That's why it's green. Safety, regulation, social connection, and the dorsal vagal state, which has shutdown, collapse, and freeze. This is the first line of defense. This is the second line of defense, and this is the third line of defense. So I think the biggest question is, okay, Fritz, this is awesome information. How do we actually know which state we are in? And the very quick answer to that, which is going to be part of our somatic practice, is posture. Our posture can tell us a lot about our nervous system state at the present moment. So let's do a quick exercise here. Right now, either if you're sitting, or make sure you're sitting for this quick exercise, it's just going to be a lot easier. Or if you're standing, that's fine too, but just take a pause, and I want you to raise your shoulders up here. Just make fists with your hands. It can either be up here or just shoulders up, make a fist, tighten your jaw even, really brace through your ribs too, and really contract your abdomen, lean forward, and just focus on a target really intently, and just stay here for a few more seconds, and just shake things off. How did that feel? How did it feel to intentionally add more energy into your system, more fight type energy in your system? I don't know about you, but now I'm all fidgety. My energy is way up. I just want to talk faster now. So now this is just a good exercise to really show us how much we are influenced with our posture, how much our posture is influencing our state of mind. And so as you can see here, I am shaking off all the sympathetic energy. If you felt a lot of arousal too, just, shake your shoulders again, shake your hands and your fists, really just drop your jaw and really soften your face to down regulate from that sympathetic response. So posture is super duper influential. And so how we know we are in the different states is based on what our posture is at the present moment. And so if we are in a fight state, which is what we just experience just now, this type of state is more you're trying to move towards. It's mostly like you're moving forward, right? You're ready to go. You are going to be on guard. You have feelings of being on guard, being inflexible, very, very defensive, like wall is up, very overprotective with what you have, your surroundings, your feelings, and there is a lot of resistance. This is the type of energy we have when we are resistant to whatever it is that we want to do, right? There's a lot of bracing as if we're protecting ourselves from whatever the stimulus is from the world so that we don't feel any uncertainty, fear, or disappointment. It's just like we're defensive because we don't want any of these things to threaten us, right? And so the type of thoughts you're going to have when you are in a fight response is I have to be on guard. I have to be close. No one can get in. I'm like, I'm ready. I'm ready to go. And it's a moving forward energy. On the other side, which is still very sympathetic and high mobilization energy, is fight or flee. Or sorry, flight or flee. This one is we're moving away. We're trying to run away from that predator, right? We can't relax. We're just gonna go. We're just gonna go, ready to go, right? Ready to go, ready to run. And this is in our body. We feel this as our muscles are very overworked because we're just wanting to go, right? We're really wanting to use those muscles. All of our blood flow is going through our peripheral skeletal muscles. And usually our neck is also tight because we're trying to run, right? Trying to run with a shoulder tension because we're trying to run here. And our breaths are shallow because we're trying to run. And our heart rate is usually high as well. And the type of thoughts that we might think is, you know, I'll be attacked if I'm vulnerable. And this can go back, this makes sense in the caveman days, right? If we are not able to flee, then a saber-toothed tiger can come and attack us. We'll be vulnerable. Or I'm afraid of showing my needs. So if I show my needs, I'll be vulnerable. I might be attacked. So these are the states that, or this is what it looks like to be in these types of sympathetic nervous system energy. So what are you like? What have you noticed within yourself with regards to this? And how is this now translating as to your daily life? Really good things to reflect on. On the other hand, we have the dorsal vagal state. The first one we want to talk about is shutdown. So both states, dorsal vagal states, are immobile, right? The ventral vagal is relaxed, it's calm, but it's also not paralyzed. This is when we get into the dorsal vagal state. It's the third line of defense. So after we go through that sympathetic state and we cannot meet the demands or don't have any energy left for it, we go into energy conservation mode, which are these two states. And they are more of like in a paralysis, immobile state. The difference between shutdown and freeze is that shutdown, we're more collapsed. So it might feel like our body is difficult to connect to. We might feel lost. And it's really just like a collapse of the spine. And we're just really sad. Our chest is sunken. The thoracic spine is rounded. Our upper shoulders are rounded too. And, you know, which confident person actually carries themselves like this? Nobody. So it's really, it also symbolizes a lack of confidence, hopelessness, a lot of depression. And this is from this state, we have difficulty standing up for ourselves because we are just, we've lost all of the energy and we've gone now back to the state where we just don't have enough to give. And the typical thoughts would be, I shouldn't be seen. I shouldn't be put myself out there. I would just rather hide because I can't even connect to myself. And it's really just that I'm just going to shut down and everybody is just going to be around. Like, I'm not going to be around anybody. I'm just going to shut myself down. On the other hand, freeze is actually a very, very interesting state. And personally, freeze is something that I didn't realize I was in until I learned all of these things. So I hope that you can definitely get a lot out of this because I definitely did. Freeze is a state where we have that sympathetic activity, that mobilization, that increase in energy, but we can't do anything about it. Like we're literally frozen, right? We're just like the deer in the headlights, right? The deer knows that the car is coming, but it ain't moving, right? It's in freeze. So there's a lot of sympathetic activation energy. And so it definitely has similar symptoms to fight or flight, but that person or that animal can't take action or can't move despite having all of this energy. And usually in this state, we feel very dissociated from our body. Like we're kind of awake, we're activated, but our bodies are they're just not doing anything, right? The brain and the body are just not communicating as well. And this is actually a very interesting state, because in this state, when we're in freeze particularly, parts of our brain involved with language and talking actually turns off. And so a lot of the times we hear this a lot, right? Why didn't this person say something? If there was an asshole boss that was really a big ass to everyone, and maybe it's, an associate or someone, why didn't they say something? Well, if that person was stuck in freeze, then they couldn't. They literally cannot, because that part of their brain has turned off until this threat has been discharged. We've all had this, right? Where something just shocks us. Like we're just in shock. We're in freeze and we're like, I can't believe this person just said that. And at that point, we couldn't say anything because we were in this freeze state. And then after we discharge that energy, after we re-regulate ourselves, maybe it's like an hour later, we are like, oh my God, I should have said this. I should have said that. But really, this is the time when we get to give ourselves compassion, because if we definitely were in a threatened freeze state, we could not speak or think properly anyway. All right. So continuing on with the nervous system states. So this is more detail as to what it looks like. Sympathetic overdrive for fight or flight, dorsal vagal shutdown or freeze. This is what it looks like in our muscles. We've talked about the posture already. It's very tight. We're guarding. We're very protective. We're protective of our organs. Whereas in the dorsal vagal shutdown state, we're very floppy. We're just like we don't even have muscle tone because we don't have the energy to bring to our muscles. And our energy is high, in the sympathetic is high. We're always on. We're ready to go, 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 go. Whereas in dorsal vagal, it's the exact opposite, where we have low energy, no will to do anything, no vitality, very, very low in motivation. Even though if we're in freeze, we have that desire or a little bit of that passion, that sympathetic energy, but we don't have the energy or the drive to do it. And because remember that vagus nerve, picture the vagus nerve, which is involved in these states, that innervates the gut, it definitely affects this part when we're dysregulated. So if we're in sympathetic overdrive, the motility of our gut is low. We might have pain. We might feel that knotted because we're bracing so much. And the blood flow there just isn't going to be prioritized, because our blood flow is prioritized in our peripheries to try to run, right? It's going in our skeletal muscles. And the other hand, for in the dorsal vagal state, one of the effects is diarrhea if we're in a chronic dorsal vagal state from the decreased stimulation in our gut, or abnormal dysregulated innervation in our gut. And so for our thoughts when we're in sympathetic overdrive usually are tons of fear. Both will have fear because our survival is threatened. So both will definitely have fear, but definitely a very, you can feel the fear in your body, very anxious, irritable, panicky, and very, very angry, hyped up, wound up. Those are the things that occur when we are in a dysregulated sympathetic overdriven state. On the other hand, in dorsal vagal, that's when we'll feel depressed, helpless, and hopeless, right? We've learned helplessness as well in psychology, where we try, we can't meet the demands, we go down into the third line of defense of the dorsal vagal. So we feel hopeless, helpless, and depressed. And lastly, the systemic effects, because our body is so, the stress response is very much felt in the body. We can feel it everywhere else. So chronic inflammation from the increased amount of adrenaline and cortisol that is not regulated and not having had the chance to bring those transmitters down. This causes chronic inflammation because we're not really allowing ourselves to rejuvenate, rest, and digest, because we're always on. And then on the other hand, once we bounce into dorsal-vagal state, we're just tired all the time. Chronic fatigue, fatigue that doesn't match what we've actually done during the day, but it is a very, very real thing. And this chronic fatigue is just because we've run out of energy and our body has decided that it's just going to conserve energy. So here in this slide, we've added the wonderful ventral vagal state, which is the spot where we want to be in. And so in the ventral vagal state, our muscles are soft. They're not overly tight or tense. There is a healthy tone with it as well. So we're not bracing, we're just relaxing. Our breath feels full instead of shallow. And our energy is very steady. It's very steady throughout the day. It's in between high and low. It ranges up and down depending on the demands that we need throughout our days. And people say that this is more of like a flow state as well. It feels like we're always in flow, that we can really tap into an increased energy if we want to and slow down if we want to. A great state to be. And then in our gut, instead of the bracing, instead of the lack of movement down there, our belly feels soft, bowel movements are regular, we are good to go. And our thoughts in this state are very clear, they're coherent. This is a misconception where if you are in a ventral vagal state that you're not going to be distracted, you're always going to be focusing. That is actually not true. Even in a ventral vagal state, we can still be distracted, especially with our world these days, that we actually, where we are distracted all the time. Distraction is normal. It's being able to bring our focus back on the things that we need to. So we can still be distracted in ventral vagal, but we're just really, really good at keeping our focus on the task at hand. And of course, because our prefrontal cortex is getting the right amount of information and is not turned off, it's actually turned on when we're in a ventral vagal state. We're able to see facts and reality as they are. We're not able to take things too personally, and we can bring in any options and choices. We have the critical thinking skills, we have decision-making skills, we can stick to them, we can rationalize, we're reasonable, and it just feels very clear and there's a lot of assurance and strength with the decisions that we make. And lastly, systemically, the normal ebb and flow between the two states to give us overall well-being, and it helps us to be adaptive and resilient. We can set boundaries if we need to. We are very much open into resting when we need to, and we have this balance that is going to be very unique to each person when we are regulated and in our ventral vagal state. This is just another way for you to visually see dysregulation. So if we're dysregulated, this part here, the red, the sympathetic response is somewhere that we're in more often. It's taking up a lot of space in our daily life, and or the dorsal vagal state here is something that we're experiencing more instead of more of the green ventral vagal state. And so when we are dysregulated, we either just go up and down, back and forth between these two states of sympathetic and dorsal vagal, and we're not really hanging out much here in ventral vagal state. And these are the typical symptoms of being in a highly hyper aroused sympathetic response. That word is very challenging, and I can't believe I've said that the whole time and I've just stumbled once. So sympathetic response, these are the typical symptoms, especially if we are dysregulated and not going back here to our safe spot. And these are the dorsal vagal states symptoms, where we feel dissociated, fatigue, shut down, and depressed.